So we're going to talk about the pelvis and the perineum. Okay, so these are some of the objectives which you should just get out of this video. Okay, so this is the pelvis. Okay, so the pelvis, it connects the lower limb to the trunk of the body. Okay, so this pelvis is made out of 4 bones, 2 hip bones on either side, a sacrum and a coccyx. So the 2 hip bones, also called the innominate bones, they fuse anteriorly to form what is called the symphysis pubis. Okay, so they also fuse posteriorly to form what is called the sacroiliac joint, which is the joint between the sacrum and the hip bone. So the hip bone is further divided into 3 bones. Okay, let me look for a nicer diagram. Okay, it's further divided into 3 bones. We have the ilium, which is superior. We have the pubis, which is anterior. Then we have the ischium, which is posterolateral. Okay, so these bones before adulthood, they are not fused. Okay, they are loosely separated together. Then after one becomes an adult, they fuse together to form what's called the acetabulum. So this acetabulum has proportions for few like the proportions of the sphere of the acetabulum are as follows. The ilium forms 2/5 of the sphere, ischium 2/5 of a sphere, and the pubis 1/5 of a sphere. So this was like a lateral. We took this pelvis, right? Let me go back here. Then we cut it in the middle. Then we're looking at the lateral view. Okay, so if we looked at it at the lateral view, this is what we saw. All right. So when these 3 bones unite, they form a foramen called the obturator foramen. This one, obturator foramen. So the obturator foramen is closed by a membrane called the obturator membrane, but this obturator membrane is incomplete to allow transmission of vessels and nerves called obturator, nerve, vein, and artery. So this canal is called the obturator canal. Okay, good. All right. So let's talk a little bit more about the pelvis. Okay, so the pelvis, it is firmly divided into 2. So we divided into 2 by this imaginary line which you call the pelvic brim. So the boundaries of the pelvic brim, or what defines the pelvic brim, is as follows. Posteriorly, we have the prominence of the first sacral vertebra, which you call the sacral promontory. This forms the posterior boundary of the pelvic brim. Then laterally, we have the inward projections of the ilium, right, of the hip bone, and continuous with the inward projection of the pubis, which you call the iliopectineal line. So these form what is called the pelvic brim, and anything above the pelvic brim is called the false pelvis. Anything below the pelvic brim is called the true pelvis, right? So the false pelvis is in direct communication with the abdominal cavity, and the boundaries of the pelvic false pelvis, we see that anteriorly we have like the skin of the abdomen, skin of the lower parts of the abdomen. Then laterally we have the iliac fossas. These are the iliac fossas, which have the iliopsoas what? Muscle. Then posteriorly we have the what? The lumbar vertebra. They form the boundaries of the false pelvis. Then the true pelvis, okay? The true pelvis is formed from this, the boundaries of the true pelvis. Let me, as you can see, this is the true pelvis, the one which is like below, as you can see below here. That's the true pelvis. Like, let me look for another. Okay, so here, these are the boundaries of the true pelvis. We're looking inferiorly, right? As you see, we're talking about something which is inferior here, so we're looking at it inferiorly here, the pelvis. So the anterior boundary is formed from the pubic arch. This is the pubic arch. Pubic arch is composed of the ischium and the pubis. Call it the ischiopubic ramus, and the pubic symphysis. They form part of the what? Pubic arch, which is the anterior boundary of the pelvic outlet. Okay, so when I was talking about the true pelvis, we say that anything below the pelvic brim is the true pelvis, right? So the true pelvis ends at the pelvic outlet. Okay, so the true pelvis is composed of three things. I think I should have mentioned that. We have the pelvic inlet, pelvic cavity, and the pelvic outlet. So the pelvic inlet is also called the pelvic brim. Okay, the pelvic brim, which we talked about. Then the pelvic cavity. Let me show you the pelvic cavity first before I get ahead of myself. This is the pelvic cavity. All right. Then after the pelvic cavity, you have the pelvic what? Outlet. So the boundaries of the pelvic brim are those that are the boundaries of the pelvic inlet. Then the boundaries of the pelvic outlet are these ones, which I was trying to show you here. Okay, these ones, in which I said that anteriorly we have the pubic arch, then laterally we have the ischial tuberosities. I'll talk more about the ischial tuberosities later. Then laterally again we have this ligament, right, which originates from the anterior surface of the sacrum and some parts from the coccyx, right? We call it the sacrotuberous ligament. We'll talk about it. Then posteriorly we have the what? The tip of the what? Coccyx. So I got a bit ahead of myself, but we'll explain about some of the terms later. Okay. Right. So in the pelvic cavity, we have pelvic organs. Right? They press towards the pelvic cavity. They press towards the pelvic cavity, such as the bladder, the uterus in the female, and the rectum. Okay. Right. So again, this is another viewpoint, right? Okay. So when we're talking about the bones of the pelvis, we say that we have the hip bones, we have the sacrum, and we have the what? The coccyx. Okay. So the sacrum is formed from 5 fused sacral bones. Okay. 5 fused sacral bones. Then the coccyx is formed from 4 fused coccygeal bones. Right. Then we see that this sacrum and coccyx is kind of supported towards the pelvic hip bone by these 2 ligaments. They are very strong ligaments. The first one, called the sacrospinous ligament, it originates from the spine of the innominate bone or hip bone, right? The spine of the hip bone. So the sacrotuberous ligament is triangular, the base coming from the lower parts of the sacrum and the coccyx attaching to the spine of the what? Of the hip bone. Then we have the sacrotuberous ligament originating from the anterolateral surface of the sacrum and some part of the coccyx attaching to the ischial tuberosity. So you see that most of these landmarks, I did not talk about them. So it's very important for us to understand the landmarks which we find on the hip bone. So this is the hip bone. This is the medial view, its medial surface. This is its what? Lateral surface. So the medial surface, we appreciate the iliac fossa for origin of which muscle? The iliopsoas. Then the anterior superior iliac spine, where we find the inguinal ligament. The anterior inferior iliac spine, which we'll talk about more when we are talking about the lower limb. So if we have iliac spines anteriorly, we have iliac spines posteriorly, one superior, one inferior, right? Then we have a notch, right? We have a greater sciatic notch and a lesser sciatic notch, right? So these notches, they are made by the ischial spine. The ischial spine kind of makes these depressions into greater sciatic notch and lesser sciatic notch. Then inferior to these notches, we have the ischial tuberosities. So the ischial tuberosities are the bony projections in which we sit on, okay? But we have the advantage that we have the buttocks, the gluteus maximus, which add the comfort here. But these are the prominences in which we sit on. It forms a very important origin for many muscles in the lower limb. We'll talk about them later, okay? So these are some of the very important landmarks. Then we have in superior pubic ramus and inferior pubic ramus, right? They are very important landmarks, okay? Then yeah, another anterior view and see. So we should appreciate the walls of the what? Of the pelvis. Walls of the what? Of the pelvis. So this is the anterior wall, right? We are seeing it from the posterior view, the anterior wall. It's formed from the what? From the body of the what? The pubis, the pubic symphysis, and the obturator membrane. They form the anterior wall of the what? The pelvis. Then the lateral wall of the pelvis, right, is formed from the ilium, right, the ilium and the sacrotuberous ligament and sacrospinous ligament. They form the lateral wall of the what? Of the pelvis. Okay. Then the floor is formed from a big muscle which you call the pelvic diaphragm. The pelvic diaphragm is formed from two muscle groups, levator ani group of muscles and the coccygeus muscle. The levator ani group of muscles is composed of 1, 2, 3, 4, 5 muscles. Then the coccygeus muscle is not part of the what? The levator ani group of what? Of muscles. Okay, so we can see that the pelvic diaphragm is deficient anteriorly to allow transmission of the urethra in both sexes and also the vagina in what? In females. Okay, so we should appreciate the differences between the male and the female pelvis. Okay, but before we do that, we should know the joints. I think I talked about some of the joints, but also another important thing are the ligaments, right? Let me just zoom in. The ligaments. Okay, so we talked about the sacrospinous ligaments, sacrotuberous ligaments. So these ones, they convert that greater sciatic notch, lesser sciatic notch into a greater sciatic foramen and lesser sciatic foramen. Okay, which is very important. Then we have ligaments which connect the ilium to the sacrum. We call them the posterior sacroiliac ligament, interosseous sacroiliac ligament, and the anterior sacroiliac ligament. Okay, so the anterior one is weak as compared to these posterior ones. Okay. Then we talked about the fact that the joint between the hip bones anteriorly is called the symphysis pubis, and it is a secondary cartilaginous joint, and the joint between the hip bones posteriorly is the sacroiliac joint, and it's a compound synovial joint. Okay. Then these ligaments are very important, these ones. Can you see that they are attaching this sacrum and coccyx? It prevents outward pouching of the what? Of the lower ends of the sacrum and the what? The coccyx. They kind of pull them and hold them in a firm fixed position, right? So you should appreciate the fact that this joint, sacroiliac joint, is movable, slightly movable, as compared to the symphysis pubis, which is immovable, right? Good. Then when we look at the coccyx, and let's just look at the coccyx. Yeah, this coccyx. Can you see the coccyx anteriorly, right? The lateral masses, the ila, lateral masses. This on the sacral promontory. Then can you see between the fourth and the fifth sacral vertebra, there can be a space in between the sacral canal, right? In between the sacral canal. So this is called the sacral hiatus. It's where we don't have fusion between the fourth and the fifth sacral vertebra. So it is very important because this is where we can put our anesthetics during surgeries. Okay. Then these are some of the anterior relations of the sacrum, right? We have this muscle, which is called the piriformis. For now, let's just appreciate it, but we'll talk more about it later, right? Then we have the sacral plexus. The sacral plexus. Okay, they are anterior relations of the what? The sacrum. All right. Okay. Then now I want us to talk about the differences between the male and the female pelvis, right? So the female pelvis, its inlet, we say that the inlet is also called the pelvic brim. The pelvic brim of the females is its transverse diameter is longer than its what? Than its antero-posterior diameter, right? So we see that its inlet is oval in shape, then that of the males is kind of heart-shaped because of an inward projecting sacral promontory, right? Then the pelvic outlet in females, right, is wide. It's wide as compared to that of the males, which is a bit narrow. Why is it narrow? We have like these bony projections inward. The ischial spines, which we're talking about, they are projected inwards and they reduce the space of the pelvic outlet. Then the pelvic cavity is cylindrical in females and short, right? And in the males, it's funnel shaped, deep, and yeah, it's funnel shaped and deep. Then the pubic arc in females, it's kind of concave, right? And that of the males is angular. And see that the angle of the subpubic angle in females is bigger than that in what? In males. In females about 80 to 85, in males is about 60 to 65, right? So this is the pathway in which the baby comes out. I know it's not making sense for now, but try to show you other diagrams. This is the pathway in which the baby comes out. Okay, the fetus, specifically the fetus comes out, right? So we would want the sacral promontory to be away as possible from the fetus. So we want it not to stick inwards, right? And this is the pelvic inlet, in which you see that the posterior boundary is the prominence of the sacral promontory anteriorly of the pubic symphysis and laterally of the iliopectineal line. In the pelvic outlet, posteriorly you said the tip of the coccyx, anteriorly the pubic symphysis, and laterally the ischial tuberosities, right? So those are some of the differences between the male and female pelvis. So the female pelvis is also called the most common one is called the gynecoid pelvis, and that in males is called the what? The android pelvis. So this is like your general female pelvis. Can you see that the pubic arc is kind of concave, it's caved, it's curved, yeah? And also the ischial tuberosities are everted as compared to the men, which is inverted here. And the sacrotuberous sacrospinous ligaments, they're kind of pulled inwards, but in the females they are like loosely oriented. They are loosely oriented, and you see that the ischial spines of the females are not projected inwards. They're kind of flat and not that prominent as compared to the males. They are very prominent, very prominent, narrowing the pelvic what? Outlet. Okay. Yeah, then what else can we talk about here? Yeah, and during pregnancy, parturition, that is childbearing, right? We see that some of the ligaments which we're talking about, they get loosened up a bit to allow for the baby to rotate as it's moving, to rotate its head and kind of flexibly come out of the uterus, right? So the only important thing about the false pelvis is it supports the graved uterus, or the uterus as it ascends from the pelvic cavity to the abdominal cavity. Kind of supports it temporarily, maybe during the 3rd month there. That's its major importance there. But other than that, it does not have any important function, the false pelvis, when you're talking about pelvis. Okay. So again, we talked about this, the flow of the what? Of the pelvis, right? It's formed from the levator anal group of muscles, which are they're actually 4. I think I said 5. No, there are 4. I counted the perineal body. So there is the levator prostati in males, sphincter vaginae in females, forms a sling around the what? The vagina. We have the puborectalis, forms a sling around the what? The rectum. Then the pubococcygeus, right? It also prevents the weakening of the perineal body. Then we have the iliococcygeus here. It prevents weakening of the anococcygeal body. So these muscles, they unite to form the anococcygeal body. Here they unite to form the perineal body, right? So this pelvic diaphragm is important because it separates the main pelvic cavity from the what? From the perineum. Okay. Separates the main pelvic cavity from the what? From the perineum. Right? Yeah. So these are some of the things which we notice when we are like as physicians or as any medical practitioner to suggest if one should have vaginal delivery. We look at the pubic arc. If it's broad, yeah, it's okay. If it's angular, question mark, that female might not have a female what? Pelvis. Okay. Then we look at the lateral walls, right? Look at the ischial spines. So the ischial spines should not be projected inward. They shouldn't be prominent. Okay. Then look at the posterior wall in which look at the sacral promontory. So if the sacral promontory, if we can palpate it, there's something wrong. If we put our maybe fingers in there, then we can palpate the sacral promontory. It means that that lady does not have a what? A female type of pelvis. Then the ischial tuberosities. So yeah, I think that's the introduction. That's the simplest introduction which we can have. Okay, so yeah, that's it for now. We talked about the pelvic orientation, talked about the false pelvis, true pelvis, the pelvic wall, pelvic diaphragm, pelvic joints, and biological sex differences. So yeah, that was it for today.